This season on Kerr Fatou.
Who is engaging them too?
No.
Fatou.
I am not at liberty to say yes or no.
Oli.
For us, every day is a new opportunity to make sure our first impressions are always our best and to see possibilities on the horizon, to make our facilities and services more accessible and find freedom all around us. With a location proximity to active markets with a liberal air transportation policy, that daily pursuit is how we turn everyday opportunities for you. For all destination marketing support, customized packages for new existing airlines and operators, and for a highly ranked tourist destination, the Gambia Civil Aviation Authority is here to serve. We regulate air transport, operate and manage BIA technical requirements merged with commercial considerations. We have experienced and well-trained aviation professionals to cater for your needs. For investment opportunities in building airport hotels, shopping malls, playground for children, do contact us on 4472-831, 4472-893. Gambia Civil Aviation Authority. We go beyond daily.
Stewart & Co. Solicitors, a legal excellence firm in London that can help you with all aspects of your legal work. If you are looking at immigrating to the United Kingdom, Stewart & Co. can help you to set up business, buy houses in the UK, and will deal with all your legal works from start to finish.
For all your general immigration work, we can help you with that as well. If you apply for any form of visa, whether student visas, settlement visas, marriage visas, or a child wanting to come to the United Kingdom to settle with the family, we can help you to achieve your goals.
Stewart & Co. Solicitors, a legal excellence firm specializing in conveyancing, immigration, litigation, family law, personal injury, licensing, no win, no fee. Contact us today at www.sk-solicitors.com.
When we touch down, better broke down.
With Gamtel G-Fiber, now you can enjoy super fast internet in gigabytes. G-Fiber is affordable, stable, secured, and accessible to homes, businesses, and enterprises. With Gamtel G-Fiber, the future is speed. Gamtel, creating a brighter future in communication.
And do small or big projects with the same dedication and commitment as we do. With a reputation as the leading printing company in the country, when it comes to major projects and innovative solutions, we always deliver in high quality, thus receiving the trust and confidence of our clients. From the moment your order is placed to when it is delivered, we believe in exceeding expectations from the sales manager to the production team, the account manager, and the person delivering your material. We have state-of-the-art equipment and a highly experienced and competent workforce that enables us to deliver top quality work on time. At reasonable prices, we provide our clients with multiple solutions right from conceptualizing, designing, printing, binding, publishing, and distribution. For all your printing requirements, we are strategically located at the Sankumsila Highway, the Gambia Printing and Publishing Corporation. We print what you desire.
Every young Gambian dreams of a university degree. He wants a good paying job after graduation, a pretty wife, and ultimately own a dream home.
What if I can't afford my desired dream home?
And that is why you need to visit Universal Properties.
We specialize in customer satisfaction. We listen to every of our clients' needs when we show the properties to our clients. Before you know it, you hear the client saying,
I like this house.
This is the room that cuts my heart.
And most of the time, they cling to the door, never to let go. Most clients want to close the deal right there. And that is why we always have their contracts in the trunk of our cars. We work at our client's pace. No haggle, no hassle.
We're waiting for you at our office in Caraba Avenue here in the Gambia.
Are you thinking of owning your dream homes? EJ Investment is here for you. Secure our quality bungalows with 2, 3 or 4 bedrooms, or our story buildings 3 or 4 to 5 bedrooms at very affordable prices with flexible payment plans at our SANYANG Seaview Estate, where you can enjoy the cool breeze with modern infrastructure such as tar roads, covered drainage system, modern electrification with street lights, gated entrance with security posts, and social amenities such as gas station, shopping mall, medical clinic, park, schools, children daycare, and a lot more. Our dedicated team of professionals will keep the estate clean at all times, provide security and patrol team within the estate premises, install latest technologies such as CCTV, Wi-Fi, home network installation, solar panel, and power backup system. Also, check out for our additional home facilities and interior design service such as premium tiling, wall plaster, home landscape, fingerprint home lock, and a lot more. Visit our office at Senegambia Kololi Highway and get a free site visit tour, or contact us on 4464838. WhatsApp us on 3259220. Or you can visit our Facebook page or Instagram on EJ Investments. EJ Investments, we are first in properties.
Sampa deena déedéet daf ma yónni woon ma joué ko bii waaw yàlla def mu gagné jàppoon $100,000 la
la ilaha illallah
te yow xam nga ne sama papa dafa amee cardiaque
yow da ngaa dof yow xam nga luy $100,000
am naa ko kay man naa lu ñëw bëggoon nga dimbali
demal na nga def damaa toog rek sama xel mi ne ci yow xam nga bërki démb li daal si benn waay fee waaw ma romb ko rek bërki démb waaw muy yuuxu di tëb ma ni kii lu ko dal ñu ne ma daal ci loto gaming Gambie bi la laal jar na ko laal na ci lu di waaw nga dafa am quarté am kente am tiercé waaw maanaam nag tey jii kente bi la te jackpot bee passé xaalis kente mooy lan kente maanaam mooy juróomi fas yi waaw beneen bi am na quarté mooy ñeenti fas yi ak tiercé tey nag xaalis bi daa gën a yokk lu tax ndax jackpot bële dañ kaa tegaat ci bii maanaam juróomi fas yi boo ko jàppee ci ordre mooy risque nga désordre bi sax day fay ah bu ma ko jàppoon yooyu moom noonu la demee da ngay dem rek g am na lu ma yaakaar man gis naa seen kii yi keesku yu ndaw yi ci biir dëkk bi mais daal dama ni lii moom amul xaalis da nga ciy def sa xaalis day jël wecce rek sànni ko fa xool jëmbat la la ilaha illallah yow li nga wax ni tey ji bu yàlla dogaloon ma gañe ko lu mu gàtt fi mu toll nii boo gañe woon $100,000 waaw lu may def waaw nooy def xam nga yow sama xarit nga waaw damay fexe nga rey say noonu ci nan lu mu gàtt $50,000 waay Cerno woowu l'ambulance
lan la lu xew ni
sa baay gay dee na
sama papa gay lu ko rey
$100,000 ne ko boo ma gàññaloon si li ma la yónni dama ko koy jox mu daanu ni sama kaw
man waxuma ko mu waxee woon la ko noonu yow la ko waroon informé ndax yow yaa ko gagné yaa gagné jàppoon
fay lempo warugal la si képp koo xam ne doomi réew mi nga ak ñu fi dëkk bu fekkee ne ci at mi sa koom-koom weesu na $2,400 mbete weer bu nekk di nga am lu tollu si $2,000 lempo si la nguur gi di sukkandiku ngir liggéey yokkute réew mi GRA mooy banxaas bu nguuri Gambia sas ngir mu fayeku lépp luy lempo ci biir réew mi ba tax na GRA di yëgal faykati lempo yi ne warugal la pour ñu fay lu ñu naan withholding tax on contract payment maanaam bépp contrat bu waay joxe te si biir réew mi la ñu toog kon xaalis si contrat bi ngeen nangotoo war nga cee wàññi ci xayma téeméer bu nekk fukka bu fekkee ne contracto bi dëkkut ci biir réew mi bu boobaa di nga war a wàññi téeméer bu nekk fukka ak juróom lii mooy lempo bu ñu naan withholding tax on contract payment lii mooy lempo bi nga xam ne yow mi joxe contrat warugal la nga wëlbatiku dem fay ko ci maakaani GRA tax office bu la gën a jege mbete ci banque yi GRA jagleel pour fay lempo war ngaa jébal lempo bi si diiri fukki fan ak juróom gannaaw bi nga wàññee ci xaalis si contrat bi amul benn contracteur bu ñu teggil fayi lempo bi xanaa mu fekk ne nguuri Gambia ñoo ko jégale boole si projet yi nga xam ne mbootaay ndimbali ñoo koy dépense GRA di fayeku lempo ngir yokkute réew mi.
Hello, welcome to this program, Let's Talk COVID. Today, we had the opportunity to have the COVID-19 response coordinator, Mr. YAYA SANYANG. YAYA, nge bismillah Kerr Fatou.
Thank you very much, Fatou. It's good to be here. If it is not the extraordinary process of COVID, this one like a trouble tema. More at stake than all of us can be, so I'm willing to do it.
Kufla le bijang ibu badi bu kiyang kaya bije bari fana sanyang kundang kaya bije yala ila konto wala tinan tarneta bi kodi.
Aha, you see. But it is an utmost serious problem, and I think we all need to face it. So that's why I think I'll be here.
In communication, connectivity is everything. We ensure that the links never sleep. Quantities and qualities, all in our data service, providing efficient, reliable voice and data service. We believe if you're not up to speed, then you're going backwards. Communications have to flow as fast as the speed of light. Whatever business you're in, having someone who understands your needs is critical. That is why we just don't offer you technology, we offer you solutions. Enjoy Gamtel's internet broadband anytime, anywhere. Your national operator, Gamtel, YAYA.
Thank you very much for honoring our invitation at the very last minute. Lafta kachamin kila YAYA wolom COVID-19 ngalone ko mansakunda sila jama londi pour que ñu courant kele courant no mi yalon ko Gambia be ay mobe jahal ay dunia be jahal Gambia be wosatel kono bari ñing lokun kilingo kono min tambita teng nga min jenna banko kan aketa kuti mi yalon ko ay mol jahal bake wolon ko banko kan sasanyin siyata bake sasanyin ala siya la fata min fango e mol fango jahal fang na alfa balje alfalo min be ko the vice president of the republic ay sasanyin soto ani minister nani nyol minister of finance agriculture petroleum ani minister of women's affairs wala labanta soto la minister of health atela results was inconclusive bare kuno nata information dima soto ko vice president atela results so yala test kele again and it came negative. Also minister of health yala results so test kele kotenke ala test keta negative ti woketa mo jamae kontan koti bari minister of health bi nyin kelo kono atele bije atele mu kelo nyaton koti kanyin sasa nyin kele oto bi wo mu feneti badingol mimbe jibero la lafta wo fole pray koy bari jannin ka dun ka sha kono nin ko YAYA SANYANG jannin mol ba fole muna tinna YAYA mu coordinator ti jumalom YAYA SANYANG
Niko YAYA SANYANG it's somebody from Quinala. I went through Quinala school, and I think I'm still a Quinalanka in all senses of the word. I went to school in Barefoot and went through to Hermitage, and therefore didn't have much education to think about. At some point in my career, I did work in the Ministry of Agriculture shortly. I did work in the Ministry of Health. But I think for the last 22 and a half years, I think that's where it comes in. I spent the better part of that time working in a very lucky condition for WHO in most outbreaks across the continent. The unfortunate event of being one of the few people who has been upfront in the outbreak responses in many African countries. So if there's no any little bit of an advantage that I've got, it's not because of any talent or any particular strength of education. It's just that I've been very fortunate to have seen many events in outbreak responses. And I think that's why somebody thought I can be considered for this. I never consider myself fit enough to do this, but I still be given the responsibility. So we will do the best we can. But that's the idea.
That's the idea. So let's look at some of the response that you have worked on in the sub-region. Yeah, Mundoku Leke around the sub-region, and what kind of pandemic did you deal with?
Okay, just for permission, I will let your speaker, your participants know that for clarity of my voice, I will remove my mask, not because wearing of mask is not critically important,
yes,
but I'm alone in my small corner of my dining room.
Yes.
Nobody around me, so I can remove my mask so that people can see me very clearly.
And hear you properly.
What we're talking about today is of utmost importance.
Yes. Yes.
With all the seriousness and clarity that is required. So I'll put off my mask, and for no other reason but because of that, for clarity, please.
That's why I don't have a mask on too, because I'm all alone in my area where I am.
Okay, that's fine. Okay.
Yes,
So maybe you can hear me much better now.
Yes.
Okay. I mean, I would wish we don't have to spend time on what I've been rolling around in Africa for the last 20 years.
Yeah.
I wish we spend more time on COVID in the Gambia, if you don't mind, because I think that's more critical for me and for all of us.
Yeah.
I'll just give you a brief. Yes, I was team lead for WHO in operations and supply management for Africa at the regional office in Brazzaville for about 12 years. Before that, I worked at the supply division at UNICEF, also global vaccine procurement. And before that, I also worked for WHO in Nigeria, in Ethiopia, and in many other countries in immunization programs. Prior to that, I also spent as senior health advisor for Save the Children's Fund. And international, I was 8-9 years as the project director and the Minister of Health for the World Bank project. But basically, that's what I have been doing professionally until you see me today.
Thank you very much.
3 weeks ago, I was a consultant for WHO on COVID response in Nigeria.
Wow, interesting. Thank you very much, Yaya, for that brief background. I think it's important for our viewers to know who you are, and this will help them to know you properly. But let's talk about your role as the coordinator of the COVID response in the Gambia. Mune muila ila role as the coordinator of COVID response in the Gambia.
Well, I see my role in 3 main areas. One is I haven't worked in the Gambian civil service for probably about 22 years and 24 years, maybe about that, 24, 25 years. My first role, I think, is to better understand what the situation is of the outbreak response in the country. First, how the civil service works, how the response works. I think the second role is to try to bring on the table my few years of experience, my few years of understanding of outbreak response, and see whether some of the ideas that they've been building up here for months, we can find a different perspective of looking at them and taking them further. There are no new ideas coming. We are only going to bring up the ideas they are doing, see how we can do them better and take them deeper on for us to be able to control and bring this outbreak to some kind of a conclusion, if possible. And I see that as a role in terms of sharing of information, bringing people together, taking ideas forward, and seeing that we all work in one synchronized way to bring this outbreak to some kind of a conclusion.
And since you took over as the coordinator, what specific strategies are you bringing up? Because a lot of us from the outside are thinking the disease has taken control over us. We have seen more cases right now, and we have seen a lot of people dying. We have seen a lot of people getting sick. It seems like the disease have controlled the country. What have you brought on the table to be able to change the narrative as we speak?
Fatou, to be honest, the answer to that, I'll be very honest with you, it is still zero. I'm learning the game. I'm 10 days, 12 days, 13 days on the job now, so I'm still learning. Stay in the UN, by the time I learn and find my feet, maybe it'll be time to move. So I'll be learning for a long, long time. And there is nothing new we are going to bring. There is not a single country I know of in the world who can say he's doing very well in COVID response. I've done few success stories. Most of those success stories, we've seen some of them being reversed. Everybody's grappling with this outbreak. Everybody's trying to find out how to do it better. Everybody's trying to understand this outbreak better. And I think we are all trying to understand it better and find better ways of doing what we are doing to bring it under control. I'm not sure any single person can bring ideas and experiences on the table that will solve this problem. It's so deep, it's so multifaceted, it's so challenging. It has to be all hands on the table, including my own hand, to see how best we can carry this forward to a conclusion. I think that's what we are all trying to bring on the table.
So yeah, give us an overview of what is the current situation of the Gambia COVID-19 cases. What is our reality right now?
This is one thing that I said it before. If anything I say on this media is conflicts with what you heard from the minister, I'm not the politician. Please tell that I am the one telling a lie. And I'm telling all your viewers that. If I say anything that conflicts with the official line, I am the one who has told a lie. So I'll be as blunt with you as I can in terms of what I see as the current situation of the outbreak.
Yeah.
First and most important thing is that we are probably not have been able to convince the Gambian population to follow the critical preventive measures necessary for COVID response. I'm thinking of regular, proper wearing of masks. I'm thinking of cough etiquette. I'm thinking of social distancing. I'm thinking of behaviors, regular hand washing. These are critical ones, and we have to get the people on our side to take this forward. I will stop here and pay homage to two groups of people who are of outstanding importance in this outbreak that we all have to get on our sides. First and foremost is the Gambian population. We have to convince people to be and behave and change for their own protection, but for everybody's protection. Our communication strategy has been very good, but it hasn't led to substantial changes in behavior. If it hasn't, we've got to do it better, deeper, and quicker. The second group of people we all have to every day sing songs to and clap are health workers, majority of whom are currently now becoming infected.
Yeah.
They don't get any extra allowances. They don't get any extra pays. They are working day and night to make all of us safe. If anybody is around today, I think we should all constantly say thank you to these health workers and find a better way of rewarding them. We all have to find a way of doing it. Now, coming back to the COVID response, first, as I said, I think we haven't got the population completely on our side. So we've got to do a bit better than that. But as I talk to now, the outbreak side in terms of the health, there are a couple of key things I want to highlight for everybody to be aware. One is the government has done exceedingly well in port of health, port of entry, surveillance, and quarantine in the first 3 months of the outbreak. It has deterred the importation of cases tremendously. That has bought us 4 or 5 months of time. But in the last 1 month, we have moved from that into a pervasive community transmission. And I'll take a bit of time and explain what we mean by pervasive community transmission. It means most Gambian cases now are getting infected from their own people in their own communities. Outside.
Yeah, can I come in there? You did mention something very important, that the government has successfully been able to reduce, to close the borders, to stop
importation.
But then people, myself and other people will tell you, all our first cases were imported cases, and even with that, what we have seen is the government letting commercial flights bringing people in and still bringing more cases. Maybe because of all of that, that's why we have.
You're wrong.
Transfers.
You're wrong in the second point. The first point, you have one, and I'll tell you why. There is no country that can safely lock up your border to avoid importation. The best you can do is to avoid rampant importation, to buy yourself time. But sooner or later, it will come.
Okay.
So what the government did was to give back time. That time should have been used to build the system for resilience, for contact tracing, for training teams, for building case management centers. That's what I said. So that bought a lot of time. But your second part is that, as far as I know, government has not opened its land and sea borders. What is allowed to come in are humanitarian flights and Gambians returning home. There is no law preventing Gambians from coming home. If a Gambian boards a plane, you cannot tell him go away, because why will he go to? So as far as I know, you can check this out, Fatou, the Gambia government has still not officially opened its land and sea.
What do you call the SN Brussels flight that comes in? Because
they are bringing Gambians back home.
Not just Gambians though, Mr.
And people who have got residential permission staying in the Gambia.
Okay, that's clear. That's
that's what I mean. These are the same thing. Okay. You are the Gambian and person who is officially resident here are the same.
Yeah. Okay.
Yeah. So as far as I know, you can check this out, because I had these stories over the media. I did my first interview, by the way. I have I've had all the stories in the media. I never responded.
Why do I have all the first interviews?
Yes, as far as I know, the Gambia government has not officially opened the land and sea borders.
Okay.
And I said the quarantine has bought time. But now, coming back to reality, so that people know what's happening about community transmission, at least 85 to more than 85% of new cases are being contacted through local transmission in their communities. To make it worse, we say we are in control of an outbreak from when I was in WHO. If we can actually account for more than 95% of all the cases happening in the community, and we know all 95% of all the contacts, we then go in a step of called mopping up. Please close the last cases. Then we know we are in control, and we start counting down. Now, but the new cases we are having, we have lost the case of transmission. We don't know how and where they are getting infected. So as I talk to you now, as I told my own wife and children and my mother, everybody has a solid responsibility now to protect yourself first. Yeah. Because whatever we put in place now, it will not take a positive effect for another couple of weeks. Mm-hmm. And I'm coming to that later on when you come to the next step of what areas we are planning to move ahead.
Yeah. So you did mention something very important here was to buy. The reason why the Gambia closed its sea and land borders, it was to buy time to develop on infrastructure and train and prepare our team. Did we have that? Because we had a 3-4 months gap, 4 months period to do all of this. Were we able to do that during that period?
You know, Fatou, somebody asked me that, and you know what I answered?
No.
I worked in 46 countries, so I tend not to look at history. I just look at what is happening now and how do you solve the problem. If I go to the history, we can make an argument for the next 3 hours. Yes, I know the case management, the case treatment centers were developed. I know rapid response teams were trained, surveillance teams were trained. I know lab teams were deployed. All of that is essential, but it's not sufficient to do what we want to do now to bring this outbreak under control.
So what is the next step now that we are caught up in this situation? Daily, we are recording more than 100 cases. Daily, we are having people dying. Yesterday, I saw videos, people dying in their cars at workplaces. Yeah. That is our reality now. This is not anything we have experienced.
No, it's reality. That's exactly how I describe it. That's reality. But I will tell you, over the last...
scary.
It's scary. To be honest, I'm looking at you straight in the face and say, this is scary.
And
Mr. is scary, he's taking you for a ride.
And Yaya, you know, na alfunkaminfo na suokono come like B nin kuketa suokono alfa se fintina ay hakilo sabatindi. People are scared. Ntel mol ne namang furelje silo contenti. But why is under your leadership, why are you guys not coming out and kang hakilo sabatindi ka fonye ko nyimbe keri ne de bari banko dingol hakilo sabatindi Yaya. It's very important.
Yes, Fatou, si c'est le taro mandia, taro long mandia. Okay, Kalonko si it's not easy to solve. So if the problem is so big, it's difficult to know how much effort is made if people haven't got practical solutions on their doorstep.
Yeah.
And we haven't reached to the point where we can say we put a practical solution on people's doorstep. And so yes, we take full responsibility of that. And we agreed on this last week that most of us would then now have to come back to the population that we are doing and talk and convince people and talk to them and give them more information. As we say in our system, you say something, you repeat it, you repeat it, you repeat it. At the point at which you are just getting tired of saying it, some people have just heard you for the first time. And you repeat the process again. You're totally right. We should have come back for everybody. We should have talked more to people. But honestly, somebody also asked me, why don't we start planning properly on what we're going to do? I said, when your boat is on fire, you run around trying to get water to quench the fire first. Then you can start talking. That's what we are trying to do. And honestly, you are right. We should and we will, from now on, start talking more to people. Most of us, and I'm hoping and wishing that nobody will use this in a political angle.
Yeah.
Made it very clear in most of our discussions over the last 2 weeks. This is a technical response. This is a national emergency.
Yeah.
We to work at this and look at the best technical solution to it, irrespective of political affiliations.
Yeah.
You cannot have your boat burning and you talk about politics. So anybody making a point scoring on this, I think is probably doing all of us a disservice.
Yeah.
If we haven't talked to the Gambians as we should, Because without the government on our side of the fence, it's a losing war.
Yeah.
I'm telling you this seriously, that I am more affected than anybody else. We all have families who are affected.
Yeah.
Now, coming back to the practical reality of what we are trying to put in place over the next 3 weeks, because I think we are almost halfway through the time, and you are free to come back, and honestly, we're going to make more and more time for all of you, all of the media, to talk to everybody more and more on a daily basis or in a 2 daily basis, because we've got to get the population on our side.
Yeah.
I mean, the first thing we do is that this is not going to be a quick and fixed solution. If anybody tells anybody we will solve this tomorrow, honestly, Fatou, I don't know any magic bullets. But 3 things, 4 things, 5 things we are going to try to focus on, and we are trying to get, and we've got, I think, goodwill from the government population, the business community, and the international community. But 4 things we are going to try to focus on exclusively in health over the next 1 month or so. The first is we have to develop a coherent community-based surveillance system.
Mm-hmm.
We have to put teams in the communities to get and count everybody who is infected and who is a contact. To do that, we've got to massively train more people, supervise them, and put them in the field. We are hoping we can get our partners like WHO, UNFPA to help us go along that line. To back that up, we have to extensify sample collection and testing capacity. As I talk to you now, we have 2 labs, one at the National Lab and one at MRC. They have a combined capacity of anywhere between 500 to 600 a day. That will not suffice. We have the expertise in MRC, we have the expertise in country, we are putting the teams together. We're hoping by next week, we will be able to develop a program of seeing how much we can extend testing more extensively to the communities to get more people access to testing. It may not happen tomorrow, but we hope we can start making a dent on it. And if you start, then slowly you will see more and more testing being available to more and more people, and therefore we can extract infected people away from the community and put them in treatment centers. We will have to extend our treatment centers because otherwise we won't be able to accommodate. Currently, we are moving into hotels for treatment. That is not the way to go. You cannot manage, you cannot put patients in a hotel. It will not happen properly. So we have to have a way of actually managing cases more in an expanded treatment center facility. The third one, we're going to do more, and I think we've probably made a more dent on that than anybody knows so far, though the victims haven't seen it come to reality. We have to protect our health workers through intensive infection prevention and control. We've got 2 experts, 1 expert coming in, hopefully in the next week or so, to begin to get training models, and we hope we can get partners to put in the equipment and material necessary to protect our health workers first. And then we can all go and face the population. The last part is probably where you people come in. We have to have the private sector come in and communicate more with people, Fatou. All of us will have to talk more. If people don't change their behavior, it's either they don't have adequate information or they didn't digest and translate the information adequately. You are an immediate person, isn't it?
Yeah.
If you tell people something and they don't understand, even your own husband or your own wife, if you tell them to understand, you repeat it until they understand, and that understanding is to translate. So we need your people's help to come and help us do that. These are the 5 key areas in health we're trying to focus on, Fatou, going forward in the next couple of weeks.
So let's talk about the medical, the healthcare workers. Today, I shared a video of one doctor who was infected with the virus, and I know that up to close to 30% of our healthcare workers are infected with the virus. With that number of chunk of people being infected, are we able to help the population right now?
The answer is yes and no. To be honest, the resilience of health workers amazes me in anywhere. The level of their commitment is amazing. We will try to meet them 3/4 way, God willing. I hope we can convince everybody. I had a few discussions with people from the National Assembly on both sides of the aisle, that that's the time we all put our table together and see how best we can all back up and support our health workers. Yes, they have taken a full impact. Our sympathies and our hearts are with them. But some of them, you'll be surprised, they came out of treatment centers, 3 days later, they came back to work. If somebody is putting that kind of commitment, we have to try to meet them some way up. And I hope we can develop something to meet them halfway through.
So to the Gambian people who are worried, sick now, I spoke to a doctor who said to me, we should all assume we are positive now, because the virus is everywhere. And nowadays you call 1025, the number that is supposed to be the hotline, and it's either they are not able to pick or they don't have the capacity. What happens to somebody who is having breathing issues and wants help and cannot get help? What do we do as a population?
Okay, I will answer the two questions then. One of the few senior colleagues that I admired and worked with for many years do the same thing. 1025 is not working. I said, hold it, phone. And I called it and I said, you are right, it's not working today. That was on a Saturday.
Yeah.
He thought I forgot about it. Monday, first thing morning, 8 o'clock, I called 25, it was working. I called that same person, I said, now it's working.
Yeah.
Our apologies for 1025 not being the perfect tool that it should have been. That's because they don't have a switchboard system that they are trying to procure and install. We are having some private sector involvement, and hopefully they'll begin to install a switchboard system now to allow the calls to be done and monitored properly. So our apologies for that, but it works. It's not a perfect tool, but it works, and I hope we can make it work better. Thursday, Friday, we contacted the network operators, and we are trying to install the switchboard and everything to work well. I don't know whether it's going to be perfect next week, but it's going to start working back again. They are using mobile phones as switchboards, and that's what actually makes it very difficult. Now, the more important question to say the virus is everywhere. I am not sure technically that is completely correct. We do not have a complete epidemiological picture of the community transmission. I agree.
Yeah.
But to say there is virus everywhere, I think is something that needs to be cautioned a little bit. There is community-wide transmission. We don't know who has the virus in the community until we begin to intensify our surveillance system. I tested several times, and God willing, I have still not, I may have, to be honest, I am almost sure if I did a blood test, I would have seen that I've got in contact with COVID, because I did go through many treatment centers before. But that's part of my job. That's part of my risk. Yeah. But I think to say that virus anywhere is a lot of connotations. I would say the opposite. Everybody has to protect himself now.
I think the reason why people are saying that is because how effective is our contact tracing? How effective is our contact tracing?
Okay, the contact tracing has been focused exclusively on the call center, and it has been exclusively focused on contacts within Banjul, Greater Banjul area. That is the data we have. Our data is not strong. It tells us that the pervasive community transmission is happening in Combo, St. Mary area, because that's where we are testing. If you move the testing today to Quinala, I don't know what we will find. If you move the testing today to Basse, I don't know what we'll find. Even the Badabungas in Salikanya, if you move the testing there today, honestly, I have no idea what we'll find. We hope we can do that. Our lab teams went up country to see how best we can develop testing and sampling and testing facilities up there. This is a lot of resources and money, and it's going to take time. But we have it on mind, and we are not forgetting it, because we have no idea what's happening there. We hope we can have better ideas soon, but it's going to take time to do it.
Out of a country, a population of 2 million people, what we have seen is just close to 7,000 people have been tested. Why is that so? Is it because we don't have the resources, or we don't have enough testing kits? Why are we not testing a lot of people?
That and more. That and more. We don't have enough sampling teams to go out in the entire community to sample everybody.
Mm-hmm.
We have not enough people trained to analyze the samples. We don't have enough equipment to handle the exponential increase in sample testing. I told you that before. That's one of the things we are working on, to see whether we can train more people, even those from the private sector, to see whether we can have more people sampling centers. But that has to be backed up by the fact that these guys, 100 people who are going to do the sampling in the community level, we have to look after them. We have to provide them with the sampling, with the protection material. And honestly, we have to, at some point, close our eyes and think of paying them a little bit more than we should pay ourselves.
Yeah.
Otherwise, nobody's going, you and I will not go there upfront every day, doing tracing in the community, talking to community people, taking samples and testing them. That's the reality of it.
Yeah.
Sooner or later, we will all have to do a little bit more work and more gratitude to these guys. And I think that's one way to go.
And we have, we have seen health workers striking in and out there, saying they have not been paid their how do you call it, their subventions, and also they are not getting enough money and they don't have proper protection gears to do their work. Recently, what we have seen on social media, I don't know how true that report is, that some of these nurses are even running away from patients because they're also scared of taking the virus to their homes. So how can we as a community help empower these health officials? Do we have the resources right now? Do we have the resources?
That answer is yes or no. Government alone cannot possibly finance this response. I told you before, it's remarkable how much positive response we had from the population. I'll give 3 examples, very quick 3 examples. We ran out of oxygen in the hospital and treatment centers. I called them, what's his name, the GPA, Gambia Port Authority, and the MD just raised a check for us for 50 bottles of oxygen almost immediately, within 2 hours. We had problems of vehicles collecting dead bodies. I called Eddie Job from the Chamber of Commerce. He called the Red Cross to hire 2 vehicles for them. We had a private person call me that he's willing to donate computers for this. That is what we are trying to do. Sorry, my train of thought is broken. But the public is support us. And honestly, we also have a very good, strong goodwill from the international community. We tap into that. We want to see whether we can buy more testing kits. We want to see whether we can train more sampling teams. We want to see whether we can train and deploy more epidemiology and surveillance teams into the community. And we hope we can be able to compensate these people reasonably well. I mean, it cannot be anything substantial to what they are doing.
Yeah.
But hopefully we can all agree that as a society, we need to do this and move it forward.
So yeah. Also, one thing that a lot of people are worried about is the time of wait when somebody gets tested. Why do we have to wait for days? What I've seen in countries like Senegal was one of the countries that was were able to develop something that a lot of people are. Even the UK, are trying to get from them. They have these scientists who develop some new technology that you can test, and it's proven to be very effective. And Senegal is our closest neighbors. We have the closest ties. Our presidents are like brothers. Why can't we seek for help from Senegal?
I spent my good part of my last few years professional life in WHO, and we have a simple statement there we make for all newcomers, no matter how talented you are. If you don't have an evidence for something, then shut up.
Okay.
We only work based on evidence. This is going to be an evidence-led response.
Okay.
If we're going to do something, we're going to have an evidence for it because it's going to account to the government people for it. We will not pull something from the air and do it.
Yeah.
Whatever we do, whatever I'm telling you here we're doing, we're going to have evidence before we say, yes, we'll go ahead with it. We have a part committee that you have to pass it through, and they're going to ask for evidence before you do it. Yes, Senegal has a rapid diagnosis test.
Yeah.
They back it up with PCR. Now, as far as I know, and I checked this, maybe somebody online would know this more than I do. I checked this out. No rapid diagnostic test has so far been validated by WHO. We don't have the capacity here in our country for somebody to bring a commercial test kit and say this works, and we test it and it works. It needs scientific people to test it. So we have to rely on what others do. I checked it. As far as I know, I don't know any rapid diagnostic test kits for corona that WHO has validated. And based on that, we go on to what we know and what our lab technicians in MRC and our national lab advise us to do. If somebody knows better than them, please kindly advise. They will review that evidence and they will advise us to change strategy.
So why is it taking that long for us to?
Now, why is it taking long? Yeah. It's because of 2 reasons. One is we only have 2 testing sites. That's MRC and national lab. The itself is the preparation that takes more time than the actual test itself.
Yeah.
The samplings accumulate. There's a limited amount of testing you can do. So if you have 1,000 tests, 2,000 test kits, or 2,000, and you can only do 500, it's going to take you 4 days to go through it. Am I right? What's coming? So if you're going to expand sampling points, you also have to expand the testing sites. The 2 that go together.
Thank you very much. But finally, left the money for la Gambian only. Mol be deuring, mol jahalta. Mama be suokona ba for la corona be mol fala. Everybody is worried. To those Gambians that are worried, you are the national coordinator. What munela message to the Gambian people?
My message to all Gambian people is a simple message I got from Mbama Emenfonyo Kununko, and she's 90-something years. I can't remember her age, but 90-something years. And Aviation, I'm not really. I think we all look forward to her.
Yeah.
Now, that's what I will tell every Gambian. So protect yourself as best as you can. Wear a mask. Wear a mask if you can. Never total. If I'm don't go to any gatherings. The most high-risk people are people who go to gatherings of all nature. Wash your hands regularly. That's what I can tell Gambians. Everybody has a singular one responsibility to protect yourself. They say every society is judged by the way they treat their dead. I think every society is judged by the way they treat their weak and vulnerable.
Yeah.
And COVID first impacts on those among us who are the weakest and themselves. We all have a right to protect these guys, Father. And I hope we can.
I hope we can. Thank you very much, Yaya. Barka bake and content bake. I hope we could have a longer conversation. But in base to Lajana again, because it's important. Thank you very much for another time. Thank you, Yaya. Barka bake. That was Yaya. Yaya is the coordinator of the COVID-19 response. Molo Mialonko, he has vast knowledge about the pandemic, Bangkok. So Kumayata Naikacha, he wanted to just come on for 30 minutes because he had another engagement. Nowadays, it's very difficult to get these health officials because they're busy running, and I do understand. The platform also because they have a lot of work to do because but I hope we can have him on again another time. We want to thank Yaya, and for all of you watching, thank you very much. We will be back again. What we are trying to do in this series is to bring the experts, to bring the politicians, and to bring the influential people so that base diamu know about this virus. Maybe if the politicians speak to the people that are following them, maybe they will listen. Maybe if the health experts explain Sasa Nyimbenyami, Molba understand that. Maybe if the influential people speak, Molba understand that. So Akumaya Tabake, Purumoli Kacha about this Sasa, Kumol explain Nyoenga, for Nyoe Sasa, Betembeda Minto. As we speak, Nimbanko can be. Momentara for more wuli cleaning feng wole in sasa to woman ke fendinte is really huge for a country like Gambia. We have almost close to 20 people minufata kununga videos jele even be I was nga moiko modol ka faila sol kono mol ka faila motol kono mol ka faila do kudula. It's very, very scary. So min kumayata wolam ko every single Gambian to take your personal precautions, to make sure you take care of yourself and your families. But also, I think I wanted to say this even at the beginning of the program. When people come out, people that are sick, they have this virus, if a message to say that I am sick and that's I'm coming out to speak. Can we not be very, let's try to be sensitive to these people, because mim akaminke wolom nim mo finti na yala message di ite nate kuma mane do for draw katina le modo mi lafta fintila wo mari be silala ka finti andunga important talam nin sa foka wanyar foka sasa wanyar foka sasa torandi foka finti band bari ni sasa nu drong modol minyantalo ne bukalo bari ngaminje wolom mol mi yalon ko be sasa ri mo jama kanu bari bi mol minu ka finti ne ka diamu mol ka finti ke castigate ka fo ko you are being paid lima don wax fi rek moy ne we know that a lot of people are sick, people are dying, and this is our reality. We're not talking about Senegal or America, we're talking about Gambia. People are dying, and when people come out to share their story, what we have observed is so many people coming out with insensitive comments towards these people. These are people that are sick, but the reason why they're coming out is to share their story, to empower all of us so that we can also get to know more about this virus so that we can protect ourselves and our families. But instead of being very sensitive to them, we send in very insensitive comments. And that I think a lot of us should be very careful of, because we need to be empowered. We need to know more about this virus to be able to help ourselves. So let's try to be sensitive to these people, and let's encourage these people to come out and speak up. I think that is very, very important in our fight against COVID-19. I want to thank you all. Join us tomorrow again for another interview of Let's Talk COVID. COVID-19 is real. Wash your hands all the time. Wear a mask. And when you are going out, when you're home with other people, wear a mask. And make sure you protect yourself and people around you. If you have symptoms that you think is COVID-19 related, please call 1025. The number is working again. It's important we report these cases, and let's not hide behind the notion that I don't want people to know I'm sick. Iko sasa niya fintindi walke mako ibarka sasa mabo aka sasa waje bindile sasa niya fintindi molbe ya long aka sasa tenkeren sasa se tenkeren sasa sita uto ba fala mole drong kana na sasa mabo na sasa fintindi na sasa nga tenkeren ni nga tenkeren drong mbe kutula sasa nyinale wo kumayata baake bara kumayata fanan mol minu ka finti ke la sasa alfo nka kata nke encourage, because ninge encourage ali ajele ni wato kono nka minke imam fati nyol be finti del kafo molebe ye fongo tanka ustaz jah nyol be finti del kafo moli ye fongo tanka alfalbe finti kan ibe diamu kam Ninta foi konyo na vice president of Sasasdol, eko minister of finance Sasasdol, minister of women's affairs, minister of agriculture, will be in Sasasdol. Uton tol kamune batu. Mba fono la nyadi ko sasa mansoto. Aku mayata bake mobile ko COVID-19 musasa timi yalon ka sototale abe nyimbanko kanne abe dunia bele kono. Nyin sasa dono fentimi dunia be londi dula killing pleni bukata. Mola tamo fongo ese ticket o sankari jelebe yaya pour ka finti ka bo banku bukata no. Goto akumayata pour moli ya lonko sasa nyi soto tale ni momo e nene ko sasa mon soto aka fon le nene sasa soto tale abe nyimbanko kanne andabe mol fa kanne goto bi ngole natale inshallah goto mbal tentula mbal jayla inshallah fo soma ala baraka. Thank you very much. Bye bye.
Have you run out of cash power? Do you want to transfer funds to your family, or do you want salary advance without coming to the bank? Your banking services have just been brought to you on your mobile phone. Download and install from your App Store or Google Play Trust Bank's mobile app. Simply search for TBL mobile app and follow the instructions. You can access the following services: funds transfer, cash power purchase, forex rates enquiries, mobile airtime top-up, mini statement, balance enquiry. TBL app is the only app that allows you to take salary advance and many more. You can also interact with your customers using our USSD code by dialing *533#. At Trust Bank, we bring innovation that is useful to you, our valued customer. With our mobile app and USSD, banking is at your fingertips. Trust Bank Limited, proudly Gambian.
Better and stronger as the sole ground operator at the Banjul International Airport. With an expansion in travel services, customers are assured of GIA's capacity to cater for all their travel needs, provided by professional, experienced, and ever-smiling staff. GIA's Hajj package and services, by far the best in the country, give the customers the opportunity for a memorable Hajj experience. For a more efficient cargo services, GIA means business as it launches its new multi-million-dollar ultra-modern cargo complex to revitalize and stimulate air transport. GIA, the pride of the Gambia.
Why did it? Why? I warula nak. Ay xam naa ne bu paree rek ma kontaan.
Sama secret mooy ami tamaate jeeg balaa jonge day mun waañam ami tamaate soo ko defee si sa tooga da koy xonqal cuur jeeg bu koy jëfandikoo sa jëkkër du la musa mere.
Waaw.
baala ma tey dama naa gis añ bi.
Chéri xiif naa de
waaye léegi ma pare topp suma lii maa ngi dem yegg kay topp suma gannaaw
loolu de laa bëgg a dégg
Faro Company mi ñu indil bébé Mariam moo ñu indil Ami Tamaate
ese sa benn cin xonq na
Ami Tamaate de moo si jaar
Ami Tamaate
waaw Ami Tamaate
moo ko xonqal nii cëm bis ni ki tey dee naa la Ami Tamaate
doomi ndey Ami Tamaate bi nag léegi ku ko bëgg nag nooy def nag nga koy am bépp marché boo dugga bitik supermarket table yi bépp foo dugga si biir réew mi di nga am Ami Tamaate
kër gi nag xam ngeen ko di boutique buñ leen indil fii ci réew mi mu nekk fan ca poori Palmarima dama ne jëkkër ak jabar ànd ak seen doom ba dugg ca biir jënd ba baax waaye looy foog ne dafa seer déedéet kër gaa ngi nii kër gi moom lu baax rek la leen amal loo soxla rek am na ci biir kër gi néeg waañ yëpp am na ci biir kër gi cabinet yëpp am na ci kër gi waay kër gi waaye kër gi daal boo duggee ca biir lu waral ree bi ree ji lu ko waral yomb gaa waral ree gi dafa yomb lool moo tax ngay ree kër gaa ngi nii dara seero fi Beko di brand boo xam ne indi lañ leen ko fii ci réewi Gambia kana ko indi kër gi waaye itamit pour dem ci office rek ñu kóot la ba nga ne nekk tay la ba nga ne nag office furniture dañu am design boo xam ne dañ la koy defal ba mu mit nag sa corporate image brand dama ne kër gi daal moo ëpp lépp kër gi daal moo am lépp kër gi daal lépp loo soxla moo lu waral ree ji yomb jee tax ngay ree du waxoon naa la ko fii dara seeru fi yaa ngi dem ba baay di nga dellu si waat kër gi di nga dellu si waat ci kër gi